Hey, this is Dr. Chris at White House Chiropractic. I'm here with Aaron, and today we're going to be doing a podcast on what do you do when you get somebody in your office and you just don't know what to do with them.
Well, it doesn't happen to me often.
Yeah, I know. It does happen to us, and I'll tell you what will happen is you'll get somebody that's been everywhere, and they've had all these procedures done. There's a term I call medical wreckage. It's a strong term, but it's for people that have been using medications and are on all these medications, and their body is just literally getting mugged by these drugs and procedures and surgeries. And so they finally come in and you got this huge list of stuff and you don't even know where to begin.
Oh, yeah.
And so they'll usually come in and they're very emotional. They're very tender to the touch. They're usually pretty obese, and they've tried so many different things, and so they'll come in. A lot of times they'll just sit down and cry. They don't know what to do. They got brain fog. They've got lack of energy. They're not sleeping. All these different problems. And for me, I want to help the person, but I want to make sure I do what's best for them. And so, what I'll do is I'll triage some of our patients. And so we triage them into 3 different categories. The first one is the one that does really well with chiropractic care. It's called the physical stressor category. And with those people, they've had repetitive stress injuries, traumas, it hurts when I do this, poor posture. Those are basically mechanically induced back problems, repetitive stress, sit all the time, and that stuff will accumulate after a while. And so those are patients that we can take care of, and really doesn't require a lot of triage. It's pretty simple. But then you'll get into some of your histories and consultations where there's a lot of other stuff going on. It's not like, ouch, this hurts, or, I've got a headache, it's worse when I've been backwards, or things like that. It's just really unusual stuff, like, they can't smell, or they might have a lot of dizziness and blurred vision and loss of balance. They've been checked for a stroke and there's no signs of a stroke. Or they've, things like they've been to a massage therapist and just touching them causes the hair to stand on their skin. So they've got a lot of autoimmune issues. They've got a lot of inflammatory issues, and that can be from toxicity. So, we've talked about on some of our other podcasts how inflammation drives all disease. Okay.
Yeah.
And so you can have inflammation from physical trauma. That's a natural process. You get the physical trauma to a joint, and then the body will protect it with scar tissue, and that's still a process that needs to be taken care of. And so we work really well with that. But the inflammatory stuff, say eating foods like corn, wheat, soy, and dairy, that can cause an autoimmune reaction, and that can lead to just like all kinds of problems, arthritis, they call them arthritides. There's probably about 20 or 30 of them. And so when you have autoimmune response and inflammation, you also have allergies. So they'll come in with, sinuses, ears, dizziness, can't sleep, no energy. I mean, it's just a never-ending cycle of just horrible suffering.
That sounds bad.
Yeah, and the first thing you don't want to do to that patient is just go ahead and start working on their spine, and in many cases, that's too painful for them to handle. Yeah, so a chemical stressor would be more of a systemic issue with the whole body. And so, you got all your systems. You got your skeletal system, that would be like your muscles, your lymphatics. Lymphatics is actually what your body uses to push fluids out of your body, or to push them somewhere where they can be gotten rid of, like in the kidneys or the bowel. And ultimately, the liver and the spleen work together with your lymphatics. Then there's the immune system, there's the muscular system, the endocrine system, respiratory, circulatory, urinary, reproductive, digestive. all those systems can become inflamed and toxic. And if you give a medication to somebody like that, it's, like they take aspirin, they take Tylenol. Typically they get addicted to drugs, they get depressed, they stay in bed. I mean, they really don't have a life.
There again, that's going back to treating the symptoms and not the...
Right, and so if they're a parent or if they're married, they don't have a happy life.
No.
And so the Detox Questionnaire is a tool that we use for people like that. And it consists of a bunch of questions that pertain to, like here's a couple of them: frequent illnesses, leaky bladder, constipation, bloated feeling, ringing in the ears, hearing loss, uncaring or disinterested.
Wow.
It gets pretty bad.
Yeah, that sounds like depression.
Yeah, and so we'll have people fill this out, and it's just crazy. And they'll score really high on it. And so what I'll do is I'll just say, hey, listen, I know you're suffering with pain, and chiropractic is really good for helping a lot of people, but when you first come in here, your primary issue is toxicity, which would be a chemical stressor. And that can be from the foods that they eat, to the medications that they take, or to the cosmetics that they use, or to anything they've been exposed to if they were raised around a farm. A lot of the sprays can create problems. But so then what we'll do is we'll put them on a detox program, which is a great program. We put tons of people on them. They've done really well. In fact, we actually did a podcast. We did 2 really good podcasts on detox, number 19, and what was the next one?
And what you're talking
26.
About. Before we started the video podcast, Dr. Banning had a audio podcast, and it's available, still out there, still available, still being downloaded often. You can get it anywhere you find your podcasts. You can go to iTunes if you're an Apple user, or any other podcast app, find it. Or it's called Your Best Health with Dr. Chris Banning. You can search for it. It'll come up.
So that was on the audio then, wasn't it?
That was all audio.
Okay,
yes,
all right.
Most of the ones on, if you're in the office, pick up a list. Dr. Banning's probably given you one already of the podcasts. We've got a nice handy little list with the first 74 podcasts on there. Now, we've done quite a few since that was printed, and we'll probably update it annually. But
that'll be good, yeah, because we've done a lot of good ones here recently. So I'll give them these podcasts to look at for detox, and then they'll look at it. The 2 podcasts are probably at least an hour and a half or 2 hours.
Yeah, I would think so.
And they'll come back, they'll have a good understanding. And then I give them a book. It's a real simple book that they can look at. And we put them on an eating program. In an eating program, there's no hacks, there's no lose weight fast or anything like that. It's mostly just healthy eating to help your body get nourished and get energized and start doing the things that it hasn't done for so long to help repair, and get rid of all these issues. So we'll do that, and we'll have them come back after 30 days, and we'll see them periodically, maybe every 10 days. They can always call us because our staff has done the detox. I do it on a regular basis, so we're very knowledgeable on the products of it. But it's a great program, and then from there we'll sit down and we'll talk about doing chiropractic care. And so that way we're addressing the big issue of the 3 main stressors: chemical stressors, physical, and mental stressors. And so that way I'm not sitting there trying to adjust somebody who's got a lot of chemical stressors, and it's really not gonna help a bunch. Okay, and so then once we get rid of a lot of the chemical stressors in the detox, the liver's working better, the endocrine system's working better, they're digesting better, they're eliminating better, they have more energy. Then we can start doing chiropractic care and get that nervous system functioning better, get rid of the physical stressors, and it makes a big difference for them.
I'm of the opinion that a detox is step 1. I believe you told me that. But before working on what's going on, cleaning the system and getting the bad stuff out.
Yeah, it's good. Everybody's got some kind of toxicity issue.
Just living today gives you that.
Yeah. If you're eating food out of the cupboard, you're getting junk. You're getting stuff in your body. So anyhow, Yeah, and so just to talk a little bit more, I'll go back a little bit about physical stressors. I want to use one of these questionnaires just as an example. So when we talk about the physical stressors, you know, sitting in a sustained position for a long period of time, like at a desk, looking forward, or doing out of position work, like a lot of plumbers will do that, air conditioning guys do that, welders do that, stockers do that. We'll have stockers that work on the low shelves.
Yeah.
In the grocery store. I got one guy that's like in his mid 80s.
Oh my goodness.
Yep. He just had a hip replacement. He started working there at Publix. I think he's been with Publix for like 50 years.
Wow.
Yeah. He's an amazing guy. But he just came off of a knee replacement. And he's having challenges working on the bottom floor at Publix, but he's doing pretty good. But what happens with physical stressors is it's cumulative, repetitive stress injuries over a period of time. And so it's micro shearing, micro tearing in the muscles, ligaments, and discs that hold everything together. And so people will come in with these physical stressors and it'll be like this. See how nice and flat this sheet of paper is right here? I mean, it's in perfect shape. I mean, everything's lined up, everything's structurally together here. So if I tear this and I kind of crinkle it up here and there, and this is simulating what happens with repetitive stress over the years, car accidents, traumas, concussions, or falling off a ladder, or taking a bad step. I just say to you, Aaron, can you unwrinkle that completely? Yeah,
that's no good.
So that's a ball of muscle, ligaments, discs, nerves, blood vessels.
I can't put that
fascia. No, you can't. Yeah, you can't. And so this is what we'll get. And so it takes time to unravel this. And so when your body's tissues are like this over the years due to sitting, repetitive stress, injuries, over time, it changes the movement patterns. So instead of being able to put your hands above your head like this, it's kind of like this, and very slow. A lot of popping and snapping. Instead of being able to move your knee nice and easy and get a good contraction, it doesn't move. The patella doesn't track. Or the spine, it doesn't move or track like it should be because of all the adjacent tissues that have all these scars around them. And so you're going to have permanent wrinkles. But in the process of treating people, or in the process of unfolding all this, what happens is we don't get a perfect piece of paper, but we do get a patient that can function and do the things that they want to on a regular basis and actually work on improving themselves every day. And so part of the things that we do for physical stressors besides chiropractic is we do therapeutic massage. We also prescribe what I call core exercises. So if your body, your tissues are all wrinkled, and your joints, like if you're over 30 years old, you've got arthritis.
Really?
Yeah, you got degeneration. Most people don't realize it. They'll always be like, I've got arthritis.
Yeah, I didn't know that.
You know, and they're like 50 or 60, and I'm like, yeah, you got arthritis.
That means I've got it.
Yeah, we all have it. I mean, it's just part of living in a gravity, in a gravity environment and being exposed to trauma. And so, so there's things that you can do. Walking is one of the best things you can do as you're trying to recover with a back injury. Walking in an upright posture, swinging your arms. Research says walking briskly 15 minutes a day is one of the best things you can do for a back problem.
I didn't know that either.
It is. The other thing is chiropractic care is very good because the bones, if they're stuck and not moving, as we demonstrate with our patients every time they come in, they need to get unstuck and get moving again, because the purpose of those joints in your spine, one of the purposes, is to send motion signals to the brain, where the brain's like, oh, I see where you're at. I see what you're doing. Oh, you want to do this? Well, let's do this. Well, if your bones are stuck and not moving, they're not sending those signals to the motion center in your brain, and that's creating stress in your body. And that's actually what I call spinal cord degeneration and brain degeneration. So it's really important to move, but move the right way. The other thing that we'll do is we'll work on They call them engrams, engrams. What that is, that's a movement pattern that is ingrained in your brain, whether it be proper or improper. But there's a lot of people that have movement patterns that are adapting to a spinal stress or a physical stress that they've had all their life, and we have to change that. And so when we change that, we change a whole bunch of things. So for physical stressors, chiropractic is very good. What we have here is very good. The third one is what I call a mental stressor. And all of us have these stressors. You know, it's kind of all hybridized into us, but the mental stressors, we get that a lot. Man, I just had a young lady, she's very, all right, let's pause it for a second. Yeah. All right, so this is what's happening in her life. She's getting married. She's in nurse practitioner school. Both her parents are sick. Her dad has bladder cancer. And so she's working on taking care of him. I can't remember what's going on with her mom.
Wow.
And she works full time.
Goodness gracious.
Yeah, and I'm like, man, you are serious. She says, yes, I am.
When does she sleep?
Yeah. Or you'll run into people that are going through valleys in their life where they lost a spouse or, they lost a child. They hate their job. They hate themselves. They don't get along in their marriage. They're in debt. So these are all mental stressors that really can be worse than any of the physical and chemical stressors. Because it is mental. Mental, the brain is what runs everything. And so, many times with that's really tough. I always, ask them, who's your closest friends, or do they have anybody they can go to, or do you go to a church? Do you have a church that cares for you? That kind of thing. And we try to lift them up and care for them in that way. But we're all human. We have these stressors here on Earth, and it leads to dis-ease in the body. And dis-ease in the body, what will happen is, just organized chaos. That's how your body develops illness. And anyhow.
I always think back to when you told me disease is dis-ease. That stuck with me.
That's good.
Yeah, dis-ease.
Yeah. So there's two strategies to dealing with these stressors in your life, and this is really simple. You can avoid the triggers. Once you find out, once we show you what the triggers are, what the causes are. So physical triggers, I'll have people that are stooped forward and are saying, I'm getting old, I can't put my shoes on. Remember that? Well, how long is your shoe horn? Oh, it's about 2 inches long. Well, get a longer shoe horn. But no, besides that, walking forward in a slumped forward position, that's a trigger for back problems. So pull the head back. Avoid the forward head posture, because that's only going to lead to nursing home posture. And you look at the nursing home, just about everybody's got that forward head slump going on. And what the forward head slump does is it turns on muscles from your neck all the way down to your lower back area. But avoid the triggers like the soy, wheat, corn, and dairy. Just avoid them.
Yep.
Okay? Avoid anything that causes pain. If you sit all day, take a break every 20 minutes and stand up, do some stretches. That's really easy to do. And then the other thing is, if there's something that relieves your pain, or if there's a posture or a movement that is easy for you and it relieves your pain, indulge in it. Okay? If there are foods that help you function better, a good example is there's a test called the cocoa test. You can take your pulse after you eat a certain food, and if your pulse shoots way up, there's a good chance it's probably not good for you.
Okay.
Gosh, I don't know.
How about Fruity Pebbles?
Fruity Pebbles?
Yeah.
I'm guessing. I mean, I like Pebbles on the Flintstones. She's pretty cute. But the cereal is really bad for you.
Okay.
That'll shoot your blood pressure up. And the reason it does is probably got high fructose corn syrup in it. It's got MSG in it. In all kinds of just horrible colors and dyes. And so,
Yeah, they're bright.
Yeah, so don't indulge in that. Indulge in something better, like, eat an egg.
Yeah.
Avocado, bacon. I eat the bacon without the additives.
I'll eat any kind of bacon, but we do buy the
Yeah, I go to Kroger's and get,
yeah.
what is it called? Simple Health or Simple,
Yeah.
Simple something,
something like that.
Yeah. And then the last is the mental stressors. We can think of a lot of verses in the Bible that talk about, avoiding, thinking about your past.
Yeah.
Things that happened to your past. In your past. You're not what happened to you in your past.
Mm-hmm.
Think on good things. Faith and hope, love, all those things are great.
Back to the Future was just a movie. There's no way we can go back and change our past. It's done.
Pretty much.
Dwelling on it does not help.
Yeah, it's written.
And I told you when I first got here, I haven't turned my TV on in 4 months, and I don't listen to the news. And my wife gets on to me about that.
What? You don't listen to the news? She gets on you about not listening to the news?
Yes, she feels like one of us needs to be in the know at all times. And I told her, well, listen away. But that has taken a load off of my mind.
Yeah, it has.
Yeah,
life better.
Yeah,
you can focus better. Your relationships are better. Your
everything's
work is better.
Yeah,
your joy is better.
Yeah,
and
prayer life.
Yeah,
but that seems to me what's going on in the world is a mental stressor to people.
Yeah, and it's tough to see it. Our church sent a team to Haiti.
Yeah.
A mission team, and they had an earthquake.
While they were there?
Just now.
Wow.
Yeah. And they're sleeping, with tents and tarps and stuff like that.
If they're lucky, yeah.
And there's Hurricane something that's headed their way right now.
How about that?
Yeah. So, anyhow, God always works in ways, anytime there's a stress, and this is what we talked about this morning, is there are some things in your life that are, for some reason, are not ever going to get better, maybe like a loved one or somebody, and it's not always God's will to heal those things or to fix those things, but He does promise us that He will give us the grace and He will give us the strength to overcome those things. But it's not going to come from us. It's going to come from Him.
Amen. That's right.
And so, it's really important.
It's so important.
We can look in the mirror and look at ourselves. That's pretty good for a while, but sometimes life will come along and give you something that you can't handle.
That's right.
Yeah, and so...
And those are times of growth, spiritually.
Right, exactly.
Too. Yeah.
And so even if the thorn in your side does not leave, you got to continually rely on that grace and that strength that God can give you. And so I'll tell you this, that's one of the best ways to handle a mental stressor. And then what happens is you get around other people that have suffered. You can share your experience with them, and they can grow, and you can help them. And so that's, to tell you the truth, as a chiropractor for 35 years, I don't know of anything else that can take care of a mental stressor other than Jesus Christ.
Amen.
Yeah. Anyhow, I don't think I have anything else to say.
Well, that's a good way to close it right there.
Okay.
So I'd like to say visit us at WhiteHouseChiropractic.com. There's all kinds of things, activities you can do on the website. You can contact us. You can watch videos, find out about other services we offer, or all the services that are offered. So check it out, WhiteHouseChiropractic.com.